Nothing But a Number promises engaging content tailored just for you. Join us as we dive deep into discussions on topics that matter to our communities.
Hello, I am Alice Bennett, Associate State Director for Advocacy with AARP Georgia, and we thank you for joining us for another episode of Nothing But a Number. So you've listened in on some of the episodes in the past, and you've heard our topics have been broad, from access to health care to digital connectivity to work and save. But when you talk about advocacy and the legislative work that we do, it cannot be done without having someone as a champion on the political side of the process. So today we have with us Mr. Andy Lord, who is a lobbyist here in the state of Georgia, and he's going to bring you a little bit more information about himself, and then we'll get into the conversation. So Andy, thank you so much for joining us. Please introduce yourself to the crowd, and then we'll go from there.
Thank you, Alice. Very glad to be here. My name is Andy Lord. I'm an Atlanta native. I live right here in Old Fourth Ward. I've got 3 kids. I am a lobbyist by trade, and I work exclusively with nonprofit clients. I represent 10 organizations in Georgia. All 10 are nonprofit. And I'm looking forward to talking about some of the things that are coming up at the Capitol this year, particularly in the healthcare space.
Awesome. And with that, let's just go right into the conversation. Healthcare access in the state of Georgia, Medicaid expansion, the not so positive buzzword on what that looks like. But being here in the state of Georgia, understanding the history of Medicaid expansion and how it has not passed in past years, understanding where you are now. So those of you who have joined us before, we had Conetta Atkins here with us from Georgians for a Healthy Future talking about the study committee on access to health care. Andy has been a very big part of getting that legislation to where it is. So given where we are in the state of Georgia and the history of Medicaid expansion, what do you think is driving this new bipartisan support that you're seeing now in the state?
It's a great question, and it's important that we emphasize new bipartisan support. So let's set the stage a little bit here too. It's important for, I think, your audience to understand that in Georgia, right now, the political composition of our state house, our state senate, governor's office, et cetera, is that Republican majorities control our state house by 20 plus seats, 10 plus in the Senate. The governor's Republican, the lieutenant governor's Republican, the insurance commissioner is Republican. You can love that. You cannot love that. Doesn't matter. That is our political composition in Georgia. And as such, it is the conservative audience and legislators that we must increasingly get to our side of this. We definitely have some, and as you indicated, there has been a huge uptick in Republican support for this. But it's important for us to understand the political composition because that informs how we approach the legislative session, the legislative body, and legislators individually. So with that as kind of the backdrop, what I will say is there are a number of things that are driving this increased support of expansion in Georgia. And one of the more fundamental parts of that drive is that it's just a good deal, right? We have a situation where the federal government is going to match state dollars at a 9-to-1 rate. Now in Georgia, we often say, we've got to run Georgia more like a business. It's a mantra you're going to hear every day at the Capitol, to which I say, agree. Show me the business that says no to a 9-to-1 match from almost anybody. And hey, I'll never ask for your vote again. But at this time, we've got an opportunity here. And I think that a lot of the legislators are really starting to understand that opportunity. Secondly, there's a prolific divide with regard to access to care between rural Georgia and urban Georgia. And Republicans disproportionately represent some of these rural areas. And what they have seen firsthand in their own communities is hospital closures. And what we have to understand there is these hospital closures are not just diminished access to care, but in many cases, these are the largest employers in these districts, or sometimes they're second behind the school system. but they are very large employers. So when these hospitals close, they're losing jobs. And what happens when your hospital closes is maybe the pharmacy that's
That's
next to that
connected to the
hospital,
hospital closes.
they close. And then the diner that's next to the pharmacy where
It
people go to get a
closes.
bite while they're waiting on their prescriptions to be filled. That diner closes, and you just start seeing this hollowing out of rural Georgia, and this kind of exodus from rural Georgia. So it is also a jobs issue that is driving some of this renewed Republican interest
Yeah.
towards expansion. And there's also an understanding that it's not just impacting, hospitals, for example, but in many areas of rural Georgia, it's not even doable for many providers. If your patient mix in some areas of rural Georgia might be 40 or 50% uninsured, 30 or 40% Medicaid, and 10 or 20% commercial pay, this is just not a business model that is sustainable for many providers, and there's a recognition of that going on as well. So I think big parts of this are that, look, this is just a good deal. It's a 9-to-1 match. It's the most fiscally responsible thing you can do. It drives jobs and employment. And if you do lose your hospital, it's also harder to attract new business to that area.
Yes.
Nobody wants to set up shop where you've got to drive 80 miles to your closest hospital. So we're seeing a convergence on this. And maybe the last thing is we've just had some distance now from the time that the ACA passed, right? It was a very politically charged dynamic when the ACA first came out, as we all recall. And as we've gotten more distance from that, that has, I think, lowered the temperature on it a little bit. So I think the convergence of these factors has driven this conversation to a place where increasingly legislators from both sides of the aisle are saying, hey, maybe it's time we give this a closer look.
And I do hope that they take it very seriously with this new commission that's coming on board. So when you talk about the newfound leadership and the bipartisan leadership on the issue, elections come, elections go, and some people are still there, some not so much. So you always have the risk of bringing in new people who have not been a part of the history, who've not been a part of the conversation, who may still have the old thinking of the Affordable Care Act and what that means, or as some call it, Obamacare, whatever they want to call it. How do you maximize on the momentum of this new set of folk that are coming in and make sure that the work that you've worked and done so much on to kind of keep us to get us where we are, how do you make sure that they're on board to make sure that the work continues to move forward?
It's a great question. So here's the deal. To your point, so Georgia elects their entire Senate and entire House every 2 years, unlike they do in D.C. The governor, lieutenant governor, AG, insurance commissioner, they're all on 4-year terms. But we have a 2-year cycle in both of our legislative branch chambers. And over the last 3 cycles, not including the one we are still currently in, we have had between 35 and 43 new members of the General Assembly in each of those 3 election cycles. So if you do the quick math on that, we're pushing up against about 120 members of the General Assembly that we would regard as still, in a relative sense, junior. First term, second term, third term. Now, to put that in context, there's 180 members of the House, there's 56 members of the Senate. So we've got 236 members of our legislative branch, and over half of those are within their first 2 or 3 terms. So there is a lot of turnover. But more importantly, the ACA passed over a decade ago. These folks were not in office for that conversation. And I think it's important for your audience to understand, let's not presume that our General Assembly, in its current posture, understands even the most fundamental tenets of the ACA. They were not in elected office. They might have been politically plugged in, of course, but they were not in office for this debate. And that means it is critical, as we talk about maximizing this momentum, it is critical that we continue to educate them. We should not presume that they know all the details of the ACA, that they know the difference between the ACA, regular Medicaid, and expansion. There are some newer folks who couldn't tell you the difference. I don't mean it derisively, but just the importance of education. There are members of the General Assembly that probably couldn't tell you off the top of their head, in some cases, the difference between Medicare and Medicaid. And it's our job to provide this education. Our General Assembly is a citizen legislature. That means they've all got day jobs. This is not their full-time job. It is when a legislator doesn't understand one of our policy priorities, that's our fault, not theirs. So this ongoing education is important because of the churn that you described. So that's one of the ways we have to keep the momentum going. We're also very intentional with the nonprofits I work with about whenever we're coming into a new term, as we will be at the top of 2025, we make it a point to reach out to the incoming new freshmen. We want to brand ourselves before our detractors or opponents have the chance. And I will say that what I have learned in years of lobbying is that the most receptive audience to any argument, without regard to party, is a freshman legislator. They're still wide-eyed. They're still like, I'm here to represent my district. They have not yet been jaded by the process. They're ready to come in. They want to save the world. They want to change the world. They're more open-minded than you're ever going to get them in many cases. And I like to get to them early and say, hey, here's what I'm working on. Here's why it's important. Here's what our opponents may tell you about it. Here's why we disagree with that position, and we would love to work with you. And you just establish, that good rapport. So we want to keep that education going. So I think that is one of the key things going. And there's one other thing that I think that we are just not good at in the nonprofit world. And I mean this broadly, which is that we are very focused, understandably, on the data, the evidence being right. We can prove it. Look at these numbers. And all of that is important, and we must deliver that information. It will be required in committee, and it is important. But it also leaves out a very important consideration for the legislators we're talking to, and that is the politics of it. We are policy people, and we talk policy, and that is important. But our audience sometimes also has to contemplate a political dimension of it that we are not subject to. In other words, they must also get reelected. And when we're dealing with things that at one point or another have become politically toxic, we talked about the ACA when it first came out, for example, they do have to calibrate and make sure that they're politically safe as well. So our job is not just to educate them that we are right. That is important. But educating them that we are right does not necessarily earn us those votes. Right. Convincing them that we're right does not mean we get that vote. And I'll use one example that's kind of outside of this space that I think does a good job of illustrating this. It's an issue I've worked on for years here in Georgia, a tobacco tax. And I mean this as for illustrative purposes here. So you go to these legislators. We have the 48th lowest tobacco tax in the country. We're hemorrhaging money. It's crushing our Medicaid budget, et cetera. Very, very, very low tobacco tax. You go to legislators, you say, hey, here's what's going on with the tobacco tax. Oh, I agree with you. We shouldn't be that low. It's killed people in my family. It's so horrible. Andy, I just can't vote with you. Why is that, Senator? Well, I can't vote for a tax increase. Because if I vote for a tax increase, I will draw a political primary opponent that will say my opponent voted to raise taxes on Georgians by $500 million. And it will technically be true. They're going to leave out the part where we're going to dedicate those revenues to rural health and healthcare access, et cetera. So we have to account for that dynamic. I can convince somebody that this bill is right. That doesn't mean I earn their vote. We must make them feel safe in their home districts. And this is where organizations like AARP, I think, are absolutely crucial to this fight with Medicaid expansion, with things like tobacco taxes, anything important. Because I believe at the end of the day, a nonprofit's success in advocacy is going to sink or swim with its grassroots.
I totally agree.
And everything else is in support of that, because legislators want to hear from folks in their backyard, in their hometown. They want to hear how it's affecting folks in their district. And this is what we must deliver on. And when we're asking them to take a politically risky vote, they need to feel sure that back home, they are safe in the next election cycle. That is our job to do. That's how we keep this momentum going, not just by educating them on Medicaid expansion in this case, but by making them feel, hey, if you go with us on this, you're going to be safe in the next election because this large employer, this largest church in our district, this community has been in communication with you. They've shared with you that they support this as well. So I think that is where our focus really needs to be. Let's get behind our grassroots. Let's not have our grassroots behind our lobbying. Let's have our lobbying behind our grassroots. Yeah. And get out there and allow these folks to feel safe at home, which allows them to help us get over the goal line.
Andy, we could continue this conversation forever and ever and ever, but unfortunately we have to wrap because I have several other questions that I could ask you, but we have to wrap at this point. But I definitely will bringing you back for further conversations on hopefully where we are with access to healthcare and some other things. So we thank you so much for joining us again for this episode of Nothing But a Number. I am Alice Bennett, Associate State Director for Georgia. Thank you again, and we look forward to seeing you online.
And that's a wrap on today's episode of Nothing But a Number. Thank you so much for joining us and diving into the conversations that shape our communities. We hope you found today's discussion enlightening and inspiring. Remember, new episodes drop every Wednesday at 12 noon on YouTube and wherever you listen to podcasts. To stay up to date with all our latest episodes and to continue exploring the topics that matter most to you, be sure to subscribe and follow Nothing But a Number on your preferred podcast platform. Your engagement and support means the world to us. If you enjoyed today's episode, please consider sharing it with friends and family who might also find value in our content. Until next time,